Magnetic resonance imaging, MRI. Are you worried at the very mention of this word? Has your doctor advised to go for an MRI test? Are you worried about the consequences? Do not worry. MRI test is as simple as a BP test and with absolute no side effects. So what is MRI all about? Let us know that.
MRI, magnetic resonance imaging. It is used by doctors to diagnose various diseases in our body. It is a technology that uses magnetic field and radio waves to give an exact picture of various organs and tissues in your body and identifies abnormalities, if any. By studying these images, medical experts will be able to arrive at a definite opinion on the condition of the patient and suggest suitable course of treatment. How it works? The huge machine you see here is what is called an MRI scanner. It is usually a huge tube-shaped magnet. When a person is put through the scan, the magnetic field aligns water molecules. The radio waves make these water molecules produce signals which are used to create images. This groundbreaking technology is the most convenient, non-invasive and reliable way to examine organs, tissues and skeletal systems.
The MRI test is really so simple. You have to see it to believe it.
To put it in another way, it is very much like an X-ray, but without the X-rays which are replaced in an MRI with a magnetic field and radio waves. Why MRI? MRI is a non-invasive and more accurate way to examine your organs, tissues and skeletal system. It gives high-resolution images and helps your doctor to diagnose various problems. Applications in various areas. Brain and spinal cord. Mainly used for imaging brain and spinal cord, it also helps diagnose aneurysms, disorders of the eye and inner ear, multiple sclerosis, spinal cord injuries, stroke, tumors, heart and blood vessels. The MRI gives a picture of the size and function of the heart chambers, thickness and movement of the walls, extent of damage caused by a heart attack, problems in aorta, plaques and blockages in the blood vessels. Internal organs. MRI is used to check for tumors and other abnormalities in organs like liver, spleen, kidneys, uterus, pancreas, prostate ovaries, etc. Bones and joints. MRI also helps evaluate joint disorders such as arthritis, joint abnormalities like repetitive injuries, disc abnormalities in the spine, bone infections, tumors of the bones and soft tissues. Breasts. MRI can also be used to detect breast cancer in women as an alternative to mammography or an addition to it in cases where women have dense breast tissue. Precautions. Are there any precautions to be taken before you go for an MRI? As MRI uses a magnetic field, any metal implants in the body may interfere with its functioning. So inform the MRI technologist about any implants you have in your body. In such a case, your doctor may advise you to go for an alternative diagnostic method. Also inform your doctor if you are pregnant. Effects of magnetic fields on fetuses are not well understood. Those with kidney or liver disorders also must inform the doctor. The implants that are likely to affect MRI scanning. Metallic joint prosthesis, artificial heart valves, an implantable heart defibrillator, pacemaker, metal clips to prevent aneurysms from leaking, cochlear implants on any other metal fragment in the body.
Patient's preparation before he or she goes to the test is the most important aspect. Let us see how a patient prepares for the test.
Take light food. Take your regular dose of medicines unless advised not to do so. Remove all ornaments, hairpins, eyeglasses, watches, dentures, hearing aids, underwear, wigs. Change into a gown. How the test goes? The MRI machine looks like a tunnel. There is a protruding bench on which you are laid down. A dye is injected into your blood vessels. This is done not for medical reasons but for the better image clarity. The bench then slowly moves into the tunnel and the scan starts with a loud noise. But do not worry, you'll not hear any of this. See these headphones. You will be wearing these phones and enjoying music as the scan does its work. If you're still uncomfortable, claustrophobic and don't want to go ahead with the procedure, then you have this balloon in your hand which you can press to alert the staff to stop the process and bring you out. While the scanning is on, you have to stay still. Any movement in your body can result in blurred images. Under sedation, in cases where patient is not at all comfortable going for the MRI in a conscious state, mild sedation may be advised.
Doctor advised me to have MRI scan. I know I have to get into cylinder-like thing which made me fear. Finally, I just had the test done. No fear, nothing. Anybody can take this test.
MRI is a safe, non-invasive, simple diagnostic method. It is free from all side effects and the patient can go back to his normal work immediately after the test if he is not under sedation. Another word of caution, if a patient is a lactating mother, she must at least wait for a single day before she breastfeeds her baby. So what else? Go for an MRI test very happily enough.